Xia gallbladder 43 is located between the fourth toe and the little toe, 0.5 cun proximal to the margin of the web. 1. Perpendicular insertion 0.3 to 0.5 cun. 2. Oblique insertion directed proximally 0.5 to 1 cun. Zhu Qiao Yin gallbladder 44 is located on the dorsal aspect of the fourth toe at the junction of lines drawn along the lateral border of the nail and the base of the nail, approximately 0.1 cun from the corner of the nail. Perpendicular or oblique insertion directed proximally 0.1 to 0.2 cun or prick to bleed. Zhu Lin Qi gallbladder 41 is located in the depression distal to the junction of the fourth and fifth metatarsal bones on the lateral side of the tendon of extensor digitorum longus, branch to little toe. Ask the patient to abduct their little toe in order to make the branch of extensor digitorum longus more prominent. Run a finger from Xia gallbladder 43 towards the ankle, along the interspace between the fourth and fifth metatarsal until it passes over this branch into the significant depression immediately beyond the tendon. Perpendicular insertion 0.5 to 1 cun. Incorrect angle of insertion will not enable the needle to pass between the shafts of the fourth and fifth metatarsal bones. Yang Fu gallbladder 38 is located on the lateral aspect of the lower leg, 4 cun superior to the prominence of the lateral malleolus, at the anterior border of the fibula. 1. The distance between the tip of the lateral malleolus and the popliteal crease is 16 cun. Locate Yang Fu gallbladder 38 at the junction of the upper 3/4 and lower quarter of this line. 2. Above the region of Xuanzhong gallbladder 39, the fibula is not easily palpable because it is covered by the peroneus brevis muscle. Therefore, feel for the anterior border of the fibula above the ankle joint where it is easily palpable, and extend a line towards the head of the fibula. Perpendicular insertion 0.7 to 1 cun. Yang Ling Quan gallbladder 34 is located below the lateral aspect of the knee in the tender depression approximately 1 cun anterior and inferior to the head of the fibula. To avoid confusing the head of the fibula with the tibial condyle, slide your fingers up the lateral aspect of the lower leg until the soft tissue of the musculature gives way to the bony prominence of the head of the fibula. Perpendicular or slightly oblique posterior insertion 1 to 1.5 cun. This point is sometimes through needle to Yin Ling Quan, spleen 9, in which case it should be located in a slightly more distal position. Da Dun liver 1 is located on the dorsal aspect of the big toe at the junction of lines drawn along the lateral border of the nail and the base of the nail, approximately 0.1 cun from the corner of the nail. Perpendicular or oblique insertion directed proximally 0.1 to 0.2 cun or prick to bleed. Xingjian liver 2 is located on the dorsum of the foot between the first and second toes, 0.5 cun proximal to the margin of the web. Needle 0.5 to 1 cun obliquely towards the heel, or use a perpendicular insertion 0.5 to 0.8 cun. Tai Chong liver 3 is located on the dorsum of the foot in the hollow distal to the junction of the first and second metatarsal bones. Run a finger from Xingjian liver 2 along the interspace between the first and second metatarsal bones towards the ankle, into the pronounced depression before the junction of the bases of the first and second metatarsals. Needle in the direction of Yongchuan, kidney 1, 0.5 to 1.5 cun. Zhongfeng liver 4 is located on the ankle, anterior to the prominence of the medial malleolus, in the significant depression just medial to the tendon of tibialis anterior when the ankle is extended, or dorsiflexed. 1. It is important to extend, or dorsiflex, the ankle by drawing the toes upwards towards the shin before locating this point. 2. This point is also described as midway between Shangqiu, spleen 5, and Jieshi, stomach 41. 3. The distance of this point from the prominence of the medial malleolus is given variously in classical sources as either 1 or 1.5 tsün. Perpendicular insertion 0.3 to 0.5 tsün, or oblique insertion medially towards Shangqiu, spleen 5, or laterally towards Jieshi, stomach 41. Chuchuan liver 8 is located just superior to the medial end of the popliteal crease, in the depression anterior to the tendons of semitendinosus and semimembranosus, about 1 tsün anterior to Yingu kidney 10. 1. It is helpful to flex the knee to locate the popliteal crease and identify the tendons of semitendinosus and semimembranosus, although the point may subsequently be needled with a pillow under the leg to semiflex it. 2. The tendon of semitendinosus, which lies posteriorly to semimembranosus, is the most prominent of the two tendons. Perpendicular or slightly posterior insertion 1 to 1.5 tsün. Li Dui, stomach 45, is located on the dorsal aspect of the second toe at the junction of lines drawn along the lateral border of the nail and the base of the nail, approximately 0.1 tsün from the corner of the nail. Perpendicular or oblique insertion directed proximally 0.1 to 0.2 tsün, or prick to bleed. Nei Ting, stomach 44, is located on the dorsum of the foot between the second and third toes, 0.5 tsün proximal to the margin of the web. 1. Perpendicular insertion 0.5 tsün. 2. Oblique insertion directed proximally 0.5 to 1 tsün. Xianggu, stomach 43, is located on the dorsum of the foot between the second and third metatarsal bones in a depression 1 tsün proximal to Nei Ting, stomach 44. Perpendicular or oblique insertion 0.5 to 1 tsün.
Jieshi, stomach 41, is located on the ankle, level with the prominence of the lateral malleolus, in a depression between the tendons of extensor hallucis longus and extensor digitorum longus. Ask the patient to extend the big toe against resistance in order to define the tendon of extensor hallucis longus, and locate Jieshi, stomach 41, lateral to this tendon and level with the prominence of the lateral malleolus. If in doubt, ask the patient to extend the remaining toes against resistance to define the tendon of extensor digitorum longus. Jieshi, stomach 41, is located between the two tendons. 1. Perpendicular insertion 0.5 tsün. 2. Oblique insertion beneath the tendons to join with Shangqiu, spleen 5, medially, or Qiushu, gallbladder 40, laterally. Caution: the anterior tibial vessels and nerve lie deep to this point.
Zhu San Li, stomach 36, is located below the knee, 3 tsün inferior to Du Bi, stomach 35, 1 finger breadth lateral to the anterior crest of the tibia. 1. First locate Yangling Quan, gallbladder 34. Zhu San Li, stomach 36, lies 1 tsün inferior to Yangling Quan, gallbladder 34, and 1 finger breadth lateral to the anterior crest of the tibia. 2. Locate 1 hand breadth below Du Bi, stomach 35. Perpendicular insertion 1 to 1.5 tsün. Yin Bai, spleen 1, is located on the dorsal aspect of the big toe at the junction of lines drawn along the medial border of the nail and the base of the nail, approximately 0.1 tsün from the corner of the nail. Perpendicular or oblique insertion directed proximally 0.1 to 0.2 tsün, or prick to bleed. Da Du, spleen 2, is located on the medial side of the big toe in the depression distal and inferior to the first metatarsophalangeal joint. This point may be found in the depression located by sliding the fingertip distally over the side of the ball of the foot. Oblique inferior insertion 0.3 to 0.5 tsün. Tai Bai, spleen 3, is located on the medial side of the foot in the depression proximal and inferior to the head of the first metatarsal bone. This point may be found in the depression located by sliding the fingertip proximally over the side of the ball of the foot. Perpendicular insertion 0.5 to 1 cun. Shangqiu, spleen 5, is located on the medial side of the ankle in the depression which lies at the junction of straight lines drawn along the anterior and inferior borders of the medial malleolus. 1. Perpendicular insertion 0.2 to 0.3 cun. 2. Transverse insertion beneath the tendons towards or to join with Jieshi stomach 41. Yinling Chuan, spleen 9, is located on the medial side of the lower leg in a depression in the angle formed by the medial condyle of the tibia and the posterior border of the tibia. 1. Run the finger in the groove posterior to the medial border of the tibia until it falls into the depression below the tibial condyle. 2. This point lies at the same level as Yangling Chuan, gallbladder 34. Perpendicular insertion 1 to 1.5 cun. Shao Chong Heart 9 is located on the dorsal aspect of the little finger at the junction of lines drawn along the radial border of the nail and the base of the nail, approximately 0.1 cun from the corner of the nail. Perpendicular or oblique insertion directed proximally 0.1 to 0.2 cun, or prick to bleed. Shao Fu Heart 8 is located on the palm in the depression between the fourth and fifth metacarpal bones, where the tip of the little finger rests when a fist is made. This point generally lies between the two transverse palmar creases. Perpendicular insertion 0.5 cun. Shenmen Heart 7 is located at the wrist joint on the radial side of flexor carpi ulnaris in the depression at the proximal border of the pisiform bone. 1. The location of this point is normally given in relation to the crease of the wrist. Since wrist creases are a superficial and variable anatomical feature, it is better to locate this point in relation to the underlying pisiform bone. 2. When it is necessary to needle a patient in the prone position with the arms towards the head, this point may be located and needled on the ulnar side of flexor carpi ulnaris, very close to the tendon insertion. The needle is then directed beneath the tendon towards its radial side. Perpendicular insertion 0.3 to 0.5 cun, or oblique insertion proximally, or distally 0.5 to 0.8 cun. Caution: the ulnar artery and ulnar nerve lie adjacent to this point. Lingdao Heart 4 is located on the radial side of the tendon of flexor carpi ulnaris, 1.5 cun proximal to Shenmen Heart 7. Perpendicular insertion 0.3 to 0.5 cun, or oblique proximal or distal insertion 0.5 to 1 cun. Shao Hai Heart 3 is located midway between Tu Zi, pericardium 3, and the medial epicondyle of the humerus, at the medial end of the transverse cubital crease when the elbow is fully flexed. Oblique insertion distally or proximally, or directed towards Tu Chur, large intestine 11, 0.5 to 1.5 cun. Shaozi, small intestine 1, is located on the dorsal aspect of the little finger at the junction of the lines drawn along the ulnar border of the nail and the base of the nail, approximately 0.1 cun from the corner of the nail. Perpendicular or oblique insertion directed proximally 0.1 to 0.2 cun, or prick to bleed. Qiangu, small intestine 2, is located on the ulnar border of the little finger in a depression just distal to the metacarpal phalangeal joint. 1. Oblique distal insertion 0.2 to 0.3 cun. 2. Perpendicular oblique insertion towards the palm, 0.5 cun. Ho Shi, small intestine 3, is located on the ulnar border of the hand in the substantial depression proximal to the head of the fifth metacarpal bone. This point is easier to locate when the hand is made into a loose fist. Perpendicular insertion 0.5 to 2 cun, directed towards Sanjian,
large intestine 3. Needle with the hand in a loose fist position, that is, with the metacarpal bones lying in the same plane. This is especially important when needling deeply towards the opposite side of the hand.
Yang-gu, small intestine 5, is located at the ulnar border of the wrist, in the depression between the head of the ulna and the triquetral bone. Most sources locate this point between the styloid process of the ulna and the triquetral bone, but in practice, the styloid process of the ulna may not be palpable, and where it is palpable, it often lies slightly posterior to Yang-gu, small intestine 5. Perpendicular insertion, 0.3 to 0.5 cun. Xiaohai, small intestine 8, is located in the depression between the tip of the olecranon process of the ulna and the tip of the medial epicondyle of the humerus. 1. Oblique distal or proximal insertion, 0.5 to 1 cun. 2. Perpendicular insertion, 0.3 to 0.5 cun. Caution: the ulnar nerve lies deep to this point. Zhi Yin, bladder 67, is located on the dorsal aspect of the little toe at the junction of lines drawn along the lateral border of the nail and the base of the nail, approximately 0.1 cun from the corner of the nail. Perpendicular or oblique insertion directed proximally, 0.1 to 0.2 cun, or prick to bleed. Zhu Tonggu, bladder 66, is located on the lateral side of the foot, in the depression anterior and inferior to the fifth metatarsophalangeal joint. First locate Shu Gu, bladder 65, then run the finger over the prominence of the metatarsophalangeal joint until it falls into the depression at the base of the little toe. Perpendicular oblique insertion towards the sole, 0.2 to 0.3 cun. Shu Gu, bladder 65, is located on the lateral side of the foot, in the depression posterior and inferior to the head of the fifth metatarsal bone. Run a finger distally along the lateral side of the foot from Jinggu, bladder 64, until it falls into the depression. Perpendicular insertion, 0.3 to 0.5 cun. Kunlun, bladder 60, is located behind the ankle joint, in the depression between the prominence of the lateral malleolus and the Achilles tendon. Locate in the center of the depression, midway between the prominence of the lateral malleolus and the posterior border of the Achilles tendon. Perpendicular insertion, 0.5 to 1 cun, or directed superiorly to join with Tai Chi kidney 3, 1.5 to 2 cun. Caution: contraindicated in pregnancy. Zhebian, bladder 54, is located on the buttock, in the depression 3 cun lateral to the sacrococcygeal hiatus. The sacrococcygeal hiatus is the depression between the bony prominences of the sacral and coccygeal cornua, just below the spinous process of the fourth sacral vertebra, if this is palpable. When the shoulder is relaxed, the 3 cun line corresponds to the medial border of the scapula. Alternatively, this point may be located midway between the midline and the lateral edge of the buttock, when the lateral edge is firmly pressed in with the palm of the hand. 1. Perpendicular insertion, 1.5 to 2.5 cun. 2. Slanted towards the anus or the genitalia, 2 to 3 cun. Yongchuan, kidney 1, is located on the sole of the foot between the second and third metatarsal bones, approximately 1/3 of the distance between the base of the second toe and the heel, in a depression formed when the foot is plantar flexed. Perpendicular insertion, 0.5 to 1 cun. Rangu, kidney 2, is located on the medial side of the foot, distal and inferior to the medial malleolus, in the depression distal and inferior to the navicular tuberosity. The navicular tuberosity is the prominence found superior to the midpoint between the ball of the foot and the heel. Perpendicular insertion, 0.5 to 1 cun. Tai Chi, kidney 3, is located in the depression between the medial malleolus and the Achilles tendon, level with the prominence of the medial malleolus. Locate in the center of the depression, midway between the prominence of the medial malleolus and the posterior border of the Achilles tendon. Perpendicular insertion 0.5 to 1 cun, or joint to Kunlun, bladder 60. Fu Liu, kidney 7, is located on the medial aspect of the lower leg, in the depression 2 cun superior to Tai Chi, kidney 3, on the anterior border of the Achilles tendon. Perpendicular insertion 0.5 to 1 cun. Yin Gu, kidney 10, is located at the medial end of the popliteal crease between the semitendinosus and semimembranosus tendons. Locate and needle with the knee slightly flexed. 1. In order to accentuate the tendons, ask the patient to tighten the hamstrings. 2. The tendon of semitendinosus, which lies posteriorly to semimembranosus, is the most prominent of the two tendons. Perpendicular insertion 1 to 1.5 cun. Zhong Chung pericardium 9 is located in the center of the tip of the middle finger. Alternatively, this point is sometimes located at the radial side of the middle finger, at the junction of lines drawn along the radial border of the nail and the base of the nail, approximately 0.1 cun from the corner of the nail. Perpendicular or oblique insertion directed proximally 0.1 to 0.2 cun, or prick to bleed. Laogong pericardium 8 is located between the second and third metacarpal bones, proximal to the metacarpophalangeal joint, in a depression at the radial side of the third metacarpal bone. 1. This point may be located at the place where the tip of the middle finger lands when a fist is made. 2. Some classical sources locate this point on the ulnar side of the third metacarpal bone, where the tip of the ring finger lands when a fist is made. Perpendicular insertion 0.5 cun. Da Ling pericardium 7 is located at the wrist joint, between the tendons of palmaris longus and flexor carpi radialis, level with Shen Men, heart 7. 1. This point is commonly described as being at the wrist crease, which is variable. It is more reliably located level with Shen Men, heart 7, which lies at the proximal border of the pisiform bone. 2. In the absence of the tendon of palmaris longus, locate this point on the ulnar side of the tendon of flexor carpi radialis. 1. Perpendicular insertion 0.3 to 0.5 cun. 2. Oblique distal insertion along the carpal tunnel for carpal tunnel syndrome 0.5 to 1 cun. Caution: the median nerve lies directly under this point, and needling commonly induces a significant electric sensation. This is an acceptable manifestation of De Qi, arrival of qi, but once elicited, further manipulation is inappropriate and may damage the nerve. Jian Shi pericardium 5 is located on the flexor aspect of the forearm, 3 cun proximal to Da Ling pericardium 7, between the tendons of palmaris longus and flexor carpi radialis. 1. In the absence of the tendon of palmaris longus, locate the point on the ulnar side of the tendon of flexor carpi radialis. 2. Divide the distance between the cubital crease and Da Ling pericardium 7 into quarters and locate this point at the junction of the proximal 3/4 and the distal quarter. Perpendicular insertion 0.5 to 1 cun, or oblique proximal insertion 1 to 1.5 cun. Chu Zi pericardium 3 is located on the transverse cubital crease, in the depression immediately to the ulnar side of the aponeurosis of the biceps brachii muscle. This point should be located and needled with the elbow slightly bent. Perpendicular insertion 0.5 to 1 cun, or prick to bleed. Caution: the brachial artery and veins lie deeply, just medial to this point. Guanchong Sanjiao 1 is located on the dorsal aspect of the ring finger, at the junction of the lines drawn along the ulnar border of the nail and the base of the nail, approximately 0.1 cun from the corner of the nail. Perpendicular or oblique insertion directed proximally 0.1 to 0.2 cun, or prick to bleed. Yue Men Sanjiao 2 is located between the ring and little fingers, 0.5 cun proximal to the margin of the web. This point is usually located and needled with the hand resting in a loose fist. The point may then be located at the proximal end of the visible crease formed by the web space. Perpendicular insertion 0.3 to 0.5 cun. Zhongzhu Sanjiao 3 is located on the dorsum of the hand in the depression just proximal to the 4th and 5th metacarpophalangeal joints. 1. Locate and needle with the hand resting in a loose fist. 2. This point may be located at the apex of an equilateral triangle formed by this point and the prominences of the metacarpophalangeal joints of the ring and little fingers. Perpendicular or oblique insertion directed proximally 0.5 to 1 cun. Zhego Sanjiao 6 is located 3 cun proximal to Yangchi Sanjiao 4 in the depression between the radius and the ulnar on the radial side of the extensor digitorum communis muscle. 1. Divide the distance between Yangchi Sanjiao 4 and the lateral epicondyle into half, and then halve the distance between this midpoint and Yangchi Sanjiao 4. 2. The point is located between the radius and the extensor digitorum communis muscle, close to the border of the radius. 1. Slightly oblique insertion towards the ulnar side, or oblique proximal, or distal insertion towards the elbow or wrist respectively, 0.5 to 1.5 cun. 2. Joined by through needling to Jianshi pericardium 5. Caution: movement of the patient's arm or hand after needling this point can result in a bent needle. Tianjing Sanjiao 10 is located with the elbow flexed. This point is located in the depression 1 cun proximal to the olecranon. Perpendicular insertion 0.5 to 1 cun. Shangyang large intestine 1 is located on the dorsal aspect of the index finger at the junction of lines drawn along the radial border of the nail and the base of the nail, approximately 0.1 cun from the corner of the nail. Perpendicular or oblique insertion directed proximally 0.1 to 0.2 cun or prick to bleed. Erjian large intestine 2 is located on the radial border of the index finger in a depression just distal to the metacarpophalangeal joint. This point will be easier to find if the index finger is relaxed in a slightly flexed position. 1. Oblique proximal or distal insertion 0.2 to 0.3 cun. 2. Perpendicular oblique insertion towards the palm 0.5 cun. Sanjian large intestine 3 is located on the radial side of the index finger in the substantial depression proximal to the head of the second metacarpal bone. This point is easier to locate when the hand is made into a loose fist. Perpendicular insertion 0.5 to 2 cun directed towards Ho Shi, small intestine 3. Needle with the hand in a loose fist position, with the metacarpal bones lying in the same plane. This is especially important when needling deeply towards the opposite side of the hand. Yangshi large intestine 5 is located on the radial side of the wrist, in the center of the hollow formed by the tendons of extensor pollicis longus and brevis, also known as the anatomical snuff box. 1. Ask the subject to extend the thumb to emphasize the hollow of the anatomical snuff box. 2. Look carefully to locate the cephalic vein which runs through the anatomical snuff box in order to avoid needling through the vein. Perpendicular insertion 0.5 to 1 cun. Zhizi large intestine 11 is located at the elbow, midway between Zhizi lung 5 and the lateral epicondyle of the humerus, at the lateral end of the transverse cubital crease. This point should be located with the elbow flexed. Perpendicular insertion 1 to 1.5 cun or joined by through needling to Shaohai, heart 3. Shaoshang lung 11 is located on the extensor aspect of the thumb at the junction of lines drawn along the radial border of the nail and the base of the nail, approximately 0.1 cun from the corner of the nail. Perpendicular or oblique insertion directed proximally 0.1 to 0.2 tsun, or prick to bleed. Yuji lung 10 is located on the thenar eminence of the hand in a depression between the midpoint of the shaft of the first metacarpal bone and the thenar muscles. Locate a needle close to the border of the metacarpal bone. Perpendicular insertion 0.5 to 1 tsun. Taiyuan lung 9 is located at the wrist joint in the depression between the radial artery and the tendon of abductor pollicis longus, level with Shenmen heart 7, the proximal border of the pisiform bone. The location of this point is normally given in relation to the crease of the wrist. Since wrist creases are a superficial and variable anatomical feature, it is better to locate this point in relation to the nearby pisiform bone. First locate Shenmen heart 7 at the lower proximal border of the pisiform bone, then find Taiyuan lung 9 at the same level. Perpendicular insertion 0.3 to 0.5 tsun, avoiding the radial artery. Jingqu lung 8 is located above the wrist 1 tsun proximal to Taiyuan lung 9 on the line connecting Taiyuan lung 9 with Gongzue lung 6 in the depression at the base of the styloid process of the radius and on the radial side of the radial artery. If the forefinger is placed on Taiyuan lung 9 and moved proximally over the palpable styloid process of the radius, it will naturally fall into the depression where Jingqu lung 8 is located. Oblique proximal or perpendicular insertion 0.3 to 0.5 tsun, avoiding the radial artery. Chizi lung 5 is located on the cubital crease of the elbow in the depression at the radial side of the tendon of biceps brachii. Locate slightly lateral to the tendon rather than immediately next to it. Locate a needle with the elbow slightly flexed, avoiding the cubital vein. Perpendicular insertion 0.5 to 1 tsun. Bai Hui Du 20 is located at the vertex on the midline in the depression 5 tsun posterior to the anterior hairline and 7 tsun superior to the posterior hairline. This point may also be measured as 8 tsun posterior to the glabella and 6 tsun superior to the external occipital protuberance. 1. Place the heels of the hands on the anterior and posterior hairlines and extend the middle fingers towards each other. Bai Hui Du 20 is located 1 tsun anterior to where the middle fingers meet. 2. If the anterior hairline is indistinct, place the heels of the hands on the glabella and external occipital protuberance and extend the middle fingers towards each other. Bai Hui Du 20 is located 1 tsun posterior to where the middle fingers meet. 3. Extend a line along the long axis of the ear, from the midpoint of the lobe to the midpoint of the apex, in its slightly posterior direction to the top of the head, where Bai Hui Du 20 may be found. Transverse insertion 0.5 to 1 tsun.